Hello and welcome to the day's episode of Focus Atlanta. I am your host, Keisha Lancelin. Thanks so much for tuning in with us this Sunday morning. In this week's episode, we'll discuss why this flu season seems to be longer than usual. We'll learn why career mentors matter beyond early career years. And we'll get tips on how to create healthy boundaries that protect your mental health. We'll begin discussing how better dental hygiene can lead to better health. I'm here with Dr. Stephen Katz.
Hi, Keisha.
Thank you so much for making time for us here in Atlanta. Let's start at the beginning. What exactly is your specialty?
Well, I'm an endodontist, and an endodontist is a dentist, but we have 2 to 3 years of additional training. We specialize on the inside of the tooth. We treat the nervous tissue, the roots, and the surrounding structures. So most of the time you would think of us as being the root canal specialist, but we're really much more than that. We're the tooth saving specialists. We help patients when they're in pain. We help patients avoid unnecessary extractions and costly additional procedures that they otherwise would not need.
So, what exactly do we know that it's time to see a specialist? What exactly might be happening for a patient to say, I think I need to see, or I think I need an endodontist?
Sure. So if you have pain or swelling, if you have sensitivity to hot or cold, or if you've broken a tooth, or if you've had trauma to your teeth, that's really the time to see an endodontist. Remember, there's no amount of pain or swelling in your mouth that should be considered normal. So if you're not sure, ask your dentist for a referral to an endodontist, or you could go to findmyendodontist.com.
When we're talking about root canals, the myth is that it's going to be super painful no matter what. Is that really true?
Yeah, that's a really good question. Thanks for asking that. So, root canal procedures are no more uncomfortable than having a routine filling done. We have new advanced techniques, improved technology, newer local anesthesia that make the procedure pain-free, quick, and comfortable. Patients will oftentimes say to me, I can't believe how easy that was. We like to say, this is not your grandmother's root canal. So don't fear the endodontist. The endodontist will take care of that tooth pain.
When you talk about fearing the dentist or fearing the endodontist, much of that is because we think, oh no, I've done too much harm. I'm going to lose these teeth. Is that always a foregone conclusion?
No, absolutely not. I think part of the reason that patients are afraid of the endodontist is because of the pain that they've had that takes them to the endodontist. Because we relieve pain. The procedure, again, is not uncomfortable, but more often than not, these patients are uncomfortable when they get to our office. So they kind of associate that with the procedure. It's not given that you need to lose the teeth. And in fact, we know that nothing looks, functions, or feels like our natural teeth. They're so important for chewing, for speaking, and for our all-important smiles. It's really important to hold on to them, but it's even more than that. We now know that if you take care of your teeth, that you'll have improved cardiovascular health, less risk of diabetes, and better cognitive function as we mature. In short, it's not only about comfort and aesthetics, it's really about improving your overall health and an investment in your long-term well-being.
Thank you so much. Before I let you go, can I get some information about where we might go on the web to find an endodontist if we need one?
Sure. So if you go to findmyendodontist.com, you could get information about saving teeth, about the procedures we do, and you can find an endodontist in your neighborhood as well.
Dr. Katz, it was a pleasure to meet you. Thanks so much for coming on the show.
Thanks for having me, Keisha.
Absolutely. All right, guys, it does not always have to be a terrible fright to go to the dentist. Many times, the things that we need to do are preventative and we can prevent having some of these procedures. But go to the website, learn more if indeed this pertains to you, and stay tuned to more Focus Atlanta. We'll be right back.